any neurosurgical procedures. Today we'll be discussing the anatomy of internal carotid artery. Dr. Daniyal is A2 resident Liaquat National Hospital. Dr. Daniyal, can you please start your presentation?
Yes, sir. Hello, Assalamu alaikum, everyone. So today's topic of presentation is anatomy of the internal carotid artery. So initially, in discussing the anatomy of the internal carotid artery, the segments of the internal carotid artery are the four segments. The orange from the is the C1, the red colored is the C1, the orange is the C2, the yellow colored is the C3 part, and the beige colored is the C4 part. This is the lateral view. A diagram is the lateral view of the internal carotid artery, and B diagram is the anterior view of the internal carotid artery. In the below in the diagram is the supraclinoid segment of internal carotid artery. A is the lateral view, and B is the anterior view of the supraclinoid segment of internal carotid artery. So the ICA is divided, as we have seen in the picture, into four parts. The first part, C1 or cervical portion, extends from its junction with the common carotid artery to the external orifice of the carotid canal. So it extends from junction of common carotid artery to external orifice of carotid canal. This one is the cervical or C1 part. The second part, sorry. The second C2 or petrous portion courses within the carotid canal and ends where the artery enters the cavernous sinus. So this is the second part or the petrous part. It starts at the orifice of carotid canal and ends where the artery enters the cavernous sinus. The third part is the orange colored part is the cavernous segment. Cavernous segment courses within the cavernous sinus and ends where the artery passes through the dura mater, forming the roof of the cavernous sinus. The fourth or supraclinoid portion begins where the artery enters the subarachnoid space and terminates at the bifurcation where it divides into ACA and MCA segments. As seen in this diagram, the fourth part is it bifurcates into the anterior cerebral artery and the middle cerebral artery. The lower segment of this diagram we will further discuss in the future slides. So going forward, when we view these C3 and C4 segments from laterally, it has curves and they curve form an S shape, and together these portions are known as carotid siphon. Lower half of the S is formed by the intracavernous portion as seen in this diagram. This is the S that is formed, S-shaped structure. Lower part is formed by the C3 and it is convex anteriorly, and the upper part of S is formed by C4 and it is convex posteriorly. And the C4 has pre-bifurcation branches that are ophthalmic branches, anterior choroidal artery, posterior communicating artery, other perforating branches, and the superior hypophyseal arteries. So the C4 or the supraclinoid segment is divided mainly into three segments. The first one is the ophthalmic segment. It extends from the roof of the cavernous sinus and the origin of the ophthalmic artery to the origin of posterior communicating artery. As seen in this diagram, this is the lateral view and this is the anterior view. The ophthalmic segments starts from the roof of cavernous sinus and where the ophthalmic artery begins to the where the posterior communicating artery arises. The blue colored is the ophthalmic segment of the supraclinoid portion of internal cerebral artery. The second is the communicating segment. It extends from the origin of posterior communicating to the origin of the anterior choroidal artery. So this is the posterior communicating and this is the anterior choroidal artery. And this light green colored is the communicating segment. That is the second segment of supraclinoid portion of internal carotid artery. The third segment is the choroidal segment, and it extends from the origin of anterior choroidal artery to the terminal bifurcation of internal carotid artery into middle cerebral and anterior cerebral arteries. So this dark green colored is the choroidal segment. It starts from anterior choroidal artery and it ends where the internal carotid artery bifurcates into ACA and MCA branches. Ophthalmic segment is the longest and the communicating segment is the shortest of them. So the perforating branches of ICA, supraclinoid segment, each of the three C4 segments gives of a series of perforating branches which have constant site of termination. Average, there are 8 perforating arteries and they range from 3 to 12, excluding the ophthalmic, posterior communicating and anterior choroidal arteries that arise from the C4. So now this diagram is from Roton. In this diagram, the left frontotemporal flap has been elevated. In this diagram, this is the inset. This a left frontotemporal incision is given. On the right side, this is the frontal lobe that has been retracted. On the left is the temporal lobe that has been retracted. So we know that internal carotid artery enters through the optic canal medial to the anterior clinoid process. This is the anterior clinoid process, and this is the supraclinoid segment, that is the C4 segment of internal carotid artery. So it bifurcates into two terminal branches. This one is the anterior cerebral arteries A1 segment, and this is the middle cerebral arteries M1 segment. Behind the internal carotid artery, we can see the third or the oculomotor nerve. This is the optic chiasm. Anteriorly is the optic nerve. Above is the olfactory tract. We can also appreciate lenticulostriate arteries that arises from the M1 segment of the middle cerebral artery. Now in this diagram, the exposure has been extended. The frontal lobe has been retracted. We can appreciate the optic chiasm, and we can also appreciate the A1, A2 segments of the ipsilateral side and the contralateral side, along with anterior communicating artery joining both of them. This one is the ipsilateral A1, which continues as A2, joined by anterior communicating artery to the contralateral A2, and here is the contralateral A1 artery. In this diagram, we can also appreciate, as this is a lateral view, this is the carotid artery. It bifurcates into an anterior cerebral artery and the middle cerebral artery. Behind the internal carotid artery, in this view, we can also see the third nerve, that is the oculomotor nerve. A recurrent artery also is being seen arising from the anterior communicating artery that passes laterally above the carotid bifurcation. In this diagram, we can hear the optic carotid artery and the optic chiasm has been retracted. And basically in this diagram, we can appreciate the optico-carotid triangle or the optico-carotid recess, which is formed by the carotid artery, the A1 segment of anterior cerebral artery, and the optic nerve and optic chiasm. And we can see below if through this triangle, the basilar bifurcation. This is the basilar artery. The basilar artery divides into posterior cerebral arteries, as we can see in this diagram. The ipsilateral and contralateral P1 segments of PCA are visible. Again, in this diagram, the carotid bifurcation, as we can see that this is the internal carotid artery. The internal carotid artery is bifurcated into the anterior cerebral artery and the middle cerebral artery. The carotid bifurcation is retracted, and we can appreciate clearly the basilar artery's apex, and it divides into two posterior cerebral arteries. The initial segment, that is the P1 segment. This we can see the contralateral P1. Also, we can see the thalamoperforating arteries in this image. Thalamoperforating artery is a branch of the posterior cerebral arteries P1 segment. And we can also appreciate lenticulostriate vessels that are branches of M1. In this image, the temporal pole has been retracted posteriorly, and this is a pretemporal exposure. On the left, we can see that the carotid and anterior choroidal vessels have been elevated so that we can get a clear view of the posterior communicating artery. The posterior communicating artery is a branch of the second segment of supraclinoid segment of internal carotid artery. So this is the posterior communicating artery. The posterior communicating artery here also is going further, and it is giving a branch which is known as premammillary artery. Another thing in this diagram is the oculomotor nerve is this one. Above the oculomotor nerve is the second segment of posterior cerebral artery, that is this one, and below the oculomotor nerve is the ipsilateral superior cerebellar artery, which is the branch of basilar artery. This is the anterior subtemporal view. The temporal pole and carotid vessel is elevated in this diagram. That is, we can see that this is the carotid artery, and along with the carotid artery that has been retracted, we can see this is the posterior communicating artery. The posterior communicating artery is joining the internal carotid artery with the posterior cerebral artery. Another important vessel that we can appreciate in this diagram is the anterior choroidal artery. The anterior choroidal artery is derived from the choroidal segment, that is the third segment of supraclinoid portion, that is the C4 portion of internal carotid artery. Here it passes backward along the medial edge of the uncus. Another important vessel that we can see here is the medial posterior choroidal artery, and it is a branch of P1 segment of P1 segment. In this diagram, the anterior choroidal artery has also been retracted, and we can see the vessel that I told you before, a premammillary branch of the PCOM artery. So this one is the premammillary artery, that is a branch of posterior communicating artery. The posterior communicating artery is originated from the communicating segment of supraclinoid portion of ICA. In this diagram, the posterior communicating artery along with anterior choroidal artery is elevated. So then we can see the posterior communicating artery is elevated.
Dr. Daniel, you're not audible.
Hello.
Yes, we can hear you now. We lost you in between for a half a minute. Can you continue where you said you where you started about uh, describing this picture?
Sir, can you hear me now clearly?
Yes, we can hear you.
Okay, okay. So in this diagram, the anterior choroidal artery has been the posterior communicating artery is elevated. This is the basilar artery. Basilar artery is divided into posterior cerebral artery. This is the ipsilateral P1 segment again, and this is the contralateral P1 segment. In this image, this superiorly is the tentorium. The tentorium has been divided. This one, this is the fourth or the trochlear nerve. It enters through this. In this image, we can see that the trochlear nerve enters through the tentorium H. Basically, in this image, the view has been extended of the basilar artery. We can also appreciate a branch that is a superior cerebellar artery that arises from the basilar artery, and it goes toward the trigeminal nerve. This is the trigeminal nerve. So now discussing about the perforating branches of internal carotid arteries. In this image, this is actually the inferior view of the internal carotid artery and its perforating branches. So in this image, we can see the important structures, that is this is the frontal lobe, this is the gyrus rectus. On the lateral aspect of gyrus rectus are the olfactory nerves, and as this is the inferior view, this is the optic chiasm. Optic chiasm anteriorly are the optic nerves, and behind is the optic tracts. Above the optic chiasm is the anterior cerebral artery. This is the anterior cerebral artery, and this bilaterally, these are the supraclinoid segments of the internal carotid artery. The supraclinoid segment bifurcates into middle cerebral artery and anterior cerebral artery. This is the middle cerebral artery, and this is the anterior cerebral artery that it goes and continues above the optic chiasm on the medial aspect of the gyrus rectus. So, as I told you before, that it has the supraclinoid segment, supraclinoid portion has three segments. The first segment is the ophthalmic segment. The ophthalmic segment arises from the ophthalmic artery. This is the ophthalmic artery, and it extends till the origin of posterior communicating artery. This blue shaded is the ophthalmic segment. The ophthalmic segment extends from ophthalmic artery to the origin of posterior communicating artery. So this is the first segment of supraclinoid portion. The segment below, that is light green colored, is the communicating segment of supraclinoid portion. The communicating segment extends from posterior communicating artery to the origin of anterior choroidal artery. The third is the choroidal segment. The choroidal segment extends from the anterior choroidal artery till the division of internal carotid artery into ACA and MCA. We will see other views also. it also has perforating branches. The ophthalmic segment gives the superior hypophyseal arteries. The blue colored arteries that are arising here, these are the superior hypophyseal arteries. The uh, choroidal segment gives these anterior perforating branches. Posteriorly, if we can come here, as this is the inferior view, here also we can appreciate that this is the infundibulum. It is below the optic chiasm. These are the mammillary bodies. This is the tuber cinerarium. Uh, uh, Posteriorly, we can also see the basilar artery that divides into posterior cerebral arteries. Again, in this diagram, as I have told you before, that these are the superior hypophyseal arteries, the branches that arises from the communicating segment. They goes till the floor of the third ventricle. This is the uh, communicating segment that is light green color. The branches goes till the floor of the third ventricle, and also it supplies the optic tracts. And the perforating branches that comes through the choroidal segment, it enters through the anterior perforated substance. These are the perforating branches that enters through the anterior perforated substance. This is the anterior view. Now this view is also of the supraclinoid portion of ICA. In this diagram, the left optic nerve has been divided, where it enters into the optic canal, and the left optic nerve has been elevated. In this image, we can see that the ophthalmic artery arises above the cavernous sinus. This is the cavernous sinus. Ophthalmic artery arises above the cavernous sinus. The carotid artery courses through the cavernous sinus, and then it laterally produces a prominence in the wall of the sphenoid sinus. This is the carotid prominence that is present in the wall of the sphenoid sinus. Uh, Also, we can see here that the components of the cavernous sinus, that are the oculomotor, trochlear, abducent, and the fifth nerve branches along with the ophthalmic nerve. This is also the anterior view. In this view, both the optic nerves are divided and they have been elevated so that we can see the lower surface of the floor of third ventricle, and along with the perforating branches that passes through that. These, as I have explained you before, that this is the ophthalmic artery. The vitreous portion comes through the optic canal on the medial aspect of the anterior clinoid process. This is the anterior clinoid process. This is the supraclinoid portion that enters through the optic canal, and it has three segments: the ophthalmic segment, the choroidal, communicating, and the choroidal segment, and it bifurcates into ACA. This is the ACA and middle cerebral artery branches. The perforating branches that I was talking before were the ophthalmic. The ophthalmic artery gives these perforating branches that are also known as infundibular branches, that goes to supply the infundibulum. The perforating branches of ophthalmic segment mostly goes to supply the optic nerve, optic chiasm, some part of the optic tracts, and the infundibulum. So this is the text that I have already explained you in the previous images. So ophthalmic segment has an average of four and a range of 1 to 7 perforating arteries that arise from the ophthalmic segment. Mostly they arise from the posterior or medial aspect of artery, and most commonly they goes to supply the infundibulum of the pituitary gland, optic chiasm, and in decreasing frequency to optic nerve, premammillary portion of third floor of third ventricle, and optic tract. the communicating segment, that is the second segment of the supraclinoid portion of internal cerebral artery. Mostly no perforating branches arise from the communicating segment in more than half of the hemispheres, and if present, only 1 to 3 are found. They arise from the posterior half of the wall and terminate in decreasing frequency, and goes to supply the optic tract, premammillary part of floor of third ventricle, and optic chiasm. The third, that is the choroidal segment. It has 4 branches that arise from choroidal segment. Mostly these branches arise from posterior half of the arterial wall, and it goes and supplies in decreasing frequency to anterior perforated substance, optic tract, and because mostly it supplies the anterior goes to the anterior perforated substance. So now discussing about the anterior and anterior inferior views of the supraclinoid portion of internal carotid artery. In this image, this is the anterior view. In this anterior view, we can see that the optic. Hello, sir, आवाज आ रही?
Yeah, we can hear you. Continue, please.
Okay. This is the anterior view. The optic nerves enter through the optic canals medial to the anterior clinoid process. So this is the anterior view. These are the optic nerves. This is the optic chiasm. Posteriorly, we cannot see that there will be optic tracts. The carotid arteries lies laterally and posteriorly to the optic nerves. Below the optic chiasm is the infundibulum. The optic nerve, as we know that it enters the optic canal medial to the anterior clinoid process. Here also this is marked in this diagram that this is the anterior clinoid process, and optic nerve enters the optic canal medial to the anterior clinoid process. Another important thing is the plenum this is the choroidal sulcus, and this is the tuberculum, and plenum sphenoidal is anterior to the chiasmatic sulcus and this tuberculum. Another important point in this diagram is that the perforating branches from the carotid arteries, they pass medially in the subchiasmatic space, that is below the chiasm, and superior hypophyseal arteries also arises from the carotid artery, and it goes to supply the infundibulum. The important point in this diagram, that is, this is the falciform process. The falciform process is a fold of the dura mater that goes above the optic nerve proximal to the optic foramen. The text about the ophthalmic artery. Now, as we know that this is the ophthalmic artery is the branch of the division of ophthalmic segment, that is the first segment of supraclinoid portion. Mostly ophthalmic arteries arises below the optic nerve in the supraclinoid area above the dural roof of cavernous sinus, and pass anterolaterally below the optic nerve to enter the optic canal and orbit. 8% of ophthalmic arteries originate within.
Daniyal, your voice, we lost you for a minute.
Most ophthalmic arteries arise anterior to the tip of anterior clinoid processes, approximately 5 mm medially to the anterior clinoid process. Intracranial segment of ophthalmic artery is usually very short. Intracranial segment, as I have said, that it arises medial from the medial third of superior surface of ophthalmic artery, and commonly enters optic foramen, but within 1 to 2 mm of its origin. The ophthalmic artery is exposed by removing the anterior clinoid process and roof of optic canal, and removing the falciform process. The falciform process is, as we already know, it is a thin fold of dura mater that extends medially from the anterior clinoid process. So now in this diagram, this is the in this diagram, the right optic nerve is divided at the optic foramen. This is the right optic nerve. This is the left optic nerve. This is the optic chiasm. This is the contralateral optic tract. This is the ipsilateral optic tract. This is the inferior lateral view. In this view, we can see that this is the anterior clinoid process. This is the internal carotid artery that enters through the optic canal medial to the anterior clinoid process. The ophthalmic segment, communicating segment, choroidal segment. Also, it bifurcates into MCA and ACA. Here in this diagram, the ACA is removed. ACA has been removed also in this diagram. So the ophthalmic segment gives the superior hypophyseal arteries and its perforating branches that goes on to supply the optic chiasm, optic nerves. The choroidal segment gives the perforating branches that goes through the anterior perforated substance. This is the anterior choroidal artery, which is the branch of choroidal segment, and it goes through the anterior perforated substance. The perforating branches that arises through the communicating segment, it goes to supply the optic tract and the floor of the third ventricle. Here in this diagram, the left optic nerve is divided at the optic foramen, and anterior cerebral artery has also been divided near its origin, and the optic nerves and chiasm has been elevated, and the perforating branches are visible. The perforating branches of the ophthalmic segment, as we can see here, it goes upward to the infundibulum, the optic nerve, chiasm, and tract. These are the perforating branches. This is the optic nerve, optic chiasm, optic tracts. These are going to supply, as we have discussed previously, that this supplies all these structures. Again, another view in this diagram, the infundibulum has been removed. This is the midbrain. The infundibulum is divided. This is the ipsilateral. This is the ipsilateral ophthalmic. This is the ipsilateral ophthalmic internal carotid artery, and this is the these are right and left internal carotid arteries that have their divisions. Also, we can appreciate that this is the basilar artery that is divided into this is the PCA, which comes by division of basilar artery. This is the right side PCA, this is the left side PCA, and this is the posterior communicating artery. It joins the PCA and the communicating segment of the ICA. Posterior communicating artery, the text about this is, it forms the lateral boundary of circle of Willis, arises from the posterior medial surface of C4 approximately midway between the origin of ophthalmic artery and terminal bifurcation. It goes backward and medially below the tuberous cinereum, above sella turcica. It is slightly above and medial to oculomotor nerve, and it joins the PCA, as we have seen in the previous diagram. The diameter at the carotid origin of PCOM is slightly larger than at junction with the PCA, but the difference is not usually more than 1 mm. Another important point is dilations of origin of posterior communicating artery from C4 are known as functional dilation or infundibular widening, and they are found in approximately 6% of hemispheres. These are the branches of PCOM artery that we have seen previously in the images. The PCOM artery supplies the in decreasing frequency to tuberous cinereum, the floor of third ventricle, posterior perforated substance, and pituitary stalk. The image that we saw initially, a branch that is the premammillary artery, is it comes through the posterior communicating artery. The premammillary artery also is known as anterior thalamoperforating artery, and it supplies the posterior hypothalamus, anterior hypothalamus, and posterior limb of internal capsule. Again, in this diagram, this is the inferior view of perforating branches of supraclinoid portion of the internal carotid artery. In this diagram, this is the inferior view, here we can see that this is the optic chiasm, this is the optic nerve. Below this, the optic chiasm is the infundibulum. These are the internal carotid artery segments. It divides into ACA and MCA. Laterally is the temporal lobe. Below is the basilar artery that divides into PCAs. PCAs goes laterally around the cerebral peduncles, and it also gives thalamoperforating. The PCA also gives thalamoperforating branches. Anterior choroidal artery. This is the branch of third segment, that is the choroidal segment of supraclinoid portion. It usually arises from C4 as single artery, and its origin is usually similar in diameter to that of ophthalmic artery, but is smaller than that of posterior communicating artery. So the course of anterior choroidal artery, this is important. The initial segment of anterior, I will show the pictures also of the course of anterior choroidal artery. The initial segment of anterior choroidal artery is directed posterior medially behind the internal carotid artery. The origin of artery is lateral to optic tract, but the initial segment crosses from lateral to medial side of the optic tract in many hemispheres, and infrequently it remains lateral to the optic tract throughout its course. It passes below and along the medial side of optic tract to reach the lateral margin of cerebral peduncle. Average length is around 12 mm. At the lateral geniculate body, anterior choroidal artery again crosses optic tract, and from medial, it comes from medial to lateral and passes through the crural cistern, and it goes through the choroidal fissure to enters the choroidal fissure, and it enters the choroid plexus within the temporal horn. Now, in this image, this is the anterior choroidal artery, and this is the inferior view. In this image, this is the carotid artery. This is the M1 segment that where the carotid bifurcates, and this is the posterior communicating artery. The important vessel that we need to discuss in this image is the anterior choroidal artery. This is the anterior choroidal artery that arises from the posterior wall of ICA, and it arises above the origin of posterior communicating artery, and it passes below and backward the optic tract. This is the optic tract. It passes below and behind the optic tract and lateral to the PCA. This is the PCA. So it's lateral initially to these structures, lateral to the optic tract initially, and it ascends on the medial surface of uncus and it travels posteriorly. So as it is going posteriorly, this is the uncus, the temporal lobe. The uncus has been retracted. This retractor has been placed on the uncus. Now, in this image, the medial part of parahippocampal gyrus has been removed. This is the parahippocampal gyrus that has been removed, and the view has been extended. The anterior choroidal artery, this is the uncus. Uncus has two segments, anterior segment and posterior segment, and where both these segments join, this is known as the apex. The anterior choroidal artery goes through the crural cistern, and after passing through the crural cistern, it appears at the upper margin of posterior ankle segment to reach the choroidal fissure. Again, in this diagram, the posterior ankle segment and temporal horn, it passes through these structures, and it enters in the choroidal fissure. This is the choroidal fissure. The choroidal fissure is located between the thalamus and the femora. Thalamus is specifically discussing about the thalamus. The lateral geniculate body forms part of the thalamus above. This is above, this is below. This is the femora, this is the lateral geniculate body, and choroidal fissure lies between them. So the anterior choroidal artery enters the choroidal fissure here, and in the next image, the floor of the temporal horn and femora have been removed. So the anterior choroidal artery's course has again been exposed. It enters the choroid plexus of temporal horn by passing through the choroidal fissure just behind the posterior segment of uncus. The lower end of one important point here is that the lower end of choroidal fissure and the site where the artery passes through the fissure, that is this point is known as the inferior choroidal point, where the anterior choroidal artery enters the choroidal fissure at its lower end. This is some text about the superior hypophyseal arteries that we have seen previously. These are a group of 1 to 5 small branches from ophthalmic segment. The largest is known as hypophyseal artery. Thank you, sir.
Thank you, Dr. Daniyal, for this detailed
Can you hear me?
presentation of the idea. Yes, Dr. Daniyal, I can hear you. Can
Hello?
you hear me?
Hello.
Dr. Daniyal, can you hear me? Dr. Daniyal, can you hear me? Dr. Daniyal, can you hear me?
Sir, can you hear me?
Yes, Dr.
Hello.
Daniyal. Can you hear me as well?
Yes, sir. Yes, sir.
So, thank you. We're sorry for these small disturbances. Thank you, Dr. Daniyal, for this detailed presentation. As you see that the course of ICA itself encompasses a lot of anatomy of other structures, starting from the petrous bone all the way till the bifurcation. And it's very important to know this anatomy for any skull-based surgery. And Dr. Daniyal, I think, did an excellent job explaining these. Thank you, Dr. Daniyal. If there's any questions from anyone, you can use the chat box. If not, we are nearly at the end of our session, and I think next week we'll be discussing either the anterior cerebral arteries or the middle cerebral arteries. If there is any question, you can use the chat box, and we'll be happy to answer this. So, Dr. Daniyal, how do you differentiate between the posterior communicating artery and the anterior carotid? You did mention it. You did mention the differences, but when you look at it, how do you differentiate which artery has a bigger diameter, and normally we know that anterior carotid artery has a longer course, but I think is it the PCOM is larger or the anterior choroidal is larger?
Sir, usually PCOM is larger than anterior choroidal artery.
And anterior choroidal has a longer course, while PCOM has a smaller course because it merges with the PCA. As you showed, that anterior choroidal has to go all the way till the temporal horn.
Yes, sir.
So since there are no questions from anyone, is there any question from our resident sitting in the conference room?
No, sir, there are no questions.
Thank you, Dr. Daniyal, for this presentation. We'll see you all next week.
Thank you, sir.
This is the end of our session. Thank you, Dr.
Thank
Daniyal.
you.